Hi everyone, my name is Myriam Kane and I will be the chair for this session. Welcome to welcome to this Standard to Racism conference. Usually we're all in person and having amazing workshop and stuff, but we're trying to reproduce that in Zoom because of the state of the pandemic where we are in. Just to say, we are recording this session, but we will be just recording the main speakers. People will be able to, people are muted, but when they will be speaking, they will be unmuted by people in tech. So yeah, welcome and let's start this amazing session. We have amazing lineup of speakers that have been doing amazing anti-racist work. So yeah, looking forward to hear from everyone today. So almost 2 years into the pandemic, and BAME communities continue to disproportionately be impacted by COVID-19, from hospitalization to death and unemployment. The government has done very little to address this. In fact, they have downplayed the disproportionate impact. The government's Commission on Race and Ethnic Disparities report was a response to the historic global Black Lives Matter movement, taking to the street demanding action and change, denying that institutional racism exists. The report was overwhelmingly rejected, condemned by the United Nations and by those who were named as its contributors. With the government due to publish its response to the Commission on Race and Ethnic Disparities report and COVID cases and deaths on the rise, it is imperative that we discuss how the anti-racist movement responds. Those are the reasons why we are here today, and hopefully when we come out of this session of this 2 days amazing, inspiring conference, we are more organized and mobilized to tackle the months and years to come. I'm delighted to be introducing our first speaker, Patrick Vernon, Windrush Justice campaigner. Patrick Vernon is a social commentator and campaigner and has been at the forefront of several high-profile campaigns on cultural heritage and social justice. Patrick led the campaign for Windrush Day. Please give a warm welcome to Patrick. Well, I don't know.
Sorry, Myriam, Patrick's not here. Can we go to Lawrence Davies, please?
Oh, because I saw his message on the chat, but we'll be coming back to Patrick shortly. I think he's having some tech issues. So Lawrence Davies, we're going to be hearing from Lawrence Davies, lawyer in Belly Mujinga case and run a law firm called Equal Justice Solicitor. That does a lot of anti-discriminatory work. Lawrence is the lawyer for the family of Belly Mujinga, a transport worker who died in COVID-19 after allegedly being spat on by a passenger. Please give a warm welcome to Lawrence.
Thank you. Look, there's a great deal of evidence, and I think it's probably indisputable, but COVID's had a disproportionate impact on Black communities. The question is why? So the CRED report reassured us, or sought to reassure us, that it wasn't because of institutional racism or structural racism. It was to do more with complex issues arising out of poverty. They didn't investigate why people found themselves in poverty, but that's the line they held. And they said it was unhelpful for people to talk about institutional racism anymore because it didn't exist. And Cressida Digby, Commissioner of the Metropolitan Police, has pretty much echoed that subsequently. Baroness Lawrence produced her own response to that question in a report called An Avoidable Crisis, and she put the causation to the disparity down to a legacy of historical racism and the structural racism that still exists in our society today. And when I read both reports, I kind of had this image of two generals sort of standing on a tower, surveying a battlefield far below, where the cultural wars were being fought out. And perhaps for that reason, the solutions that both reports were suggesting were very generic and vague. So what was happening on the ground in the battle? Well, we know there's significant health inequalities in our society. The Marmot report reported in 2010 about that and may still apply today. There's also significant distrust between Black communities and the government, and in particular the NHS. And that's because of historical nightmares such as the syphilis experiment that was conducted in the States. And even today, quite a senior person in a pharmaceutical company told me quite recently that all new drugs are tested first in Africa, and then if successful in Europe, and then if successful in the States. When I asked why that was, it's because the litigation risk in the States was far worse than in the other two areas, but there's an inherent racism in that approach that perhaps pharmaceutical companies are not factoring in. In terms of employment, racism on the ground, racial harassment at work has doubled since 2017, according to the TUC. Racism in universities is now at an institutionally racist level, according to a report this year, and racism in secondary schools and schools have been 50,000 incidents of racial harassment in schools in the last 5 years. One troubling stat I heard recently was a nine-year-old black boy was stopped on his way back from a school in a leafy suburb of London, questioned by the police repeatedly. And they just left him there. And when the parents challenged it later, they said it was a welfare stop. And even though he was walking back from the same school as the white kids who were in front of him and behind him, he was the only one stopped. And when questioned why, if they stopped him due to his welfare, they hadn't just put him in the car and run him home onto the next street, they said they had no explanation for that. And of course, we have racial assaults at work. And that's what the Belly Mujinga case is centering on. So during COVID, a lot of Black workers are working in frontline roles, so they're more exposed to the disease and the pandemic. And the lack of PPE in frontline occupations has also been a problem. We've got racial assaults still occurring at work more so. Belly Mujinga situation is an example of that, because the guy who assaulted her assaulted another Black female and then waited for the ticket window to be open for a Black female to serve him rather than taking another available window with a non-Black female officer. So definitely targeted Black females that day. And then in terms of flexible working, a lot of people in more, in quotes, middle class professions can work from home, do flexible working. A lot of Black workers are unfortunately disproportionately engaged in the low wage economy, so have less flexibility to do that. And health and safety generally in the low wage economy is worse than in other sectors of society, because it's all based on keeping costs down and keeping wages down. And often the manager just doesn't have any sort of humanity about them when they're trying to deliver a service in the low wage economy. So in terms of solutions, an avoidable crisis was very short on solutions, and that's because I don't think the structural problems are properly understood in terms of how to resolve them. So one of the examples in an avoidable crisis was that we should introduce ethnicity pay reporting. That's just a really terrible idea for the reasons I'm about to tell you. So in Birmingham City Council, there was an equal pay claim. 11,000 cooks, cleaners and carers brought an equal pay claim. They were awarded £1,250 million, even though the gender pay reporting was very good at Birmingham City Council at the time. But the underlying equal pay debt was colossal, which means women are currently owed £1 trillion. And the ethnicity pay gap is running at between 26 and 37%. So the ethnicity pay gap is about 300 billion. And so the solution really is transfer 300 billion into Black communities, and you're taking your first step to fight racial inequality, and anything else is just purely cosmetic and won't make any difference. And I've been told to stop, so I'll stop. Thank you.
Thank you so much, Lawrence, for those incredible facts and for this incredible contribution. Patrick is here now, but before that, I just would like to say for people that are here today, the registration for this conference is free, but Zoom facilities cost money. So if you like to donate to the cost of this conference, please go. We're going to share a link here for how to donate. We need the money to be able to do, the top 1% have the money, but we have the people, and people contributing to this cause is very important for us to be able to continue to do the amazing work that we're doing and the organizing and mobilizing that is needed to be done. Thank you so much. Now I'm gonna bring back Patrick. So Patrick Vernon is a Windrush justice campaigner. Patrick Vernon is a social commentator and campaigner, and has been at the forefront of several high-profile campaigns on cultural heritage and social justice. Patrick led the campaign for Windrush Day. Please give a warm, warm welcome again to Patrick. I think is he here? Yeah.
Hi everyone, apologies for being late, so I'm not surprised, but I had some technical problems. I'm actually in the doing some research work actually on my next book, which is looking at for this art in the middle of Black History Month. I've spent the last couple of weeks speaking at so many events about the importance of Black History Month, why we need Black History Month, and how can we use Black History Month around liberating ourselves, our minds, and things.
Patrick, sorry to interrupt. I think you might have to turn your video off because the sound is very poor in the pickup.
Okay, fine. Is that better?
Yeah.
That's much better.
Yeah. I mean, I've got my headphones. Let me put my headphones, if that would make a difference, they can still see me. That's if you want to still see me. But I'll carry on. So, in the context of this, it's very pertinent that we've got this event during halfway through Black History Month.
And one of the key challenges has always been about making a case for Black History Month. I'm a bit worried what's happened now. Is that better? Yeah.
Yes, that's excellent now.
Okay, no problem at all. So, as you know, we're in the middle of what is called a cultural war, a war that we didn't create, a war that's been created by this government. And the premise of this cultural wars is quite important because it's trying to rain down on celebrating Black History Month and Black history, but not just Black history, but other histories, issues around LGBT, issues to do with gender, all the histories that you can think of, Gypsy travelers, Southeast Asian history, you name it, it's all there. And it's trying to reinforce and tell us that the British Empire was great. You are grateful to be in Britain in the first place. And thirdly, look at all these wonderful achievements that Black and brown people have made. So why are you complaining and moaning about? It's what you mean. So that is part of that context. And then they're using a whole range of apparatus, planning legislation to stop local authorities from removing racist statues. They're threatening arts and heritage organisations to say that if you attempt to decolonize or anything at all that you're thinking of doing, we will cut your funding. And thirdly, and more importantly, through a whole range of organizations and pro-woke, maybe, people, or I don't know how you call it, class opposite of woke, basically criticizing people like ourselves, activists, for creating social divisions, racism, you name it. So this is part of the strategy, which is, I wouldn't say it's been cleverly orchestrated under this government, but it's part of this government, basically. While people are dying of COVID, contracts are going to the private sector for friends and chums. And, something, so, and the government talks about levelling up, it's actually levelling down inequality, levelling down social justice, etc. So we've got a we've got a battle on our hands. But for some of us who have been around the block, we had similar experiences during the height of fascism in the 80s and 90s. And what happened, if you remember, during that period, there was a resurgence of activism. The role of arts and creativity helped and played a key role, and music, rock against racism, a whole range of things were happening during that period under Thatcher. And I think it's happening here again in the context of Black Lives Matter and a whole range of issues around the impact of climate change. And so I think one of the key issues that what we have to do as activists is to maintain the narrative of fighting race equality, social justice. It's important that we counter any racist or facts and figures and do some serious fact checking against the government when they use data and information to demonstrate or prove that they are right. Classic example, as we all know, and we've talked about this on this stance to racism over the last 7 months around the Tony Sewell report. About how they've deliberately manipulated data to make the point there's no structural racism, and we've explored this already. So we have to be vigilant around these key issues, around challenging the narrative as well. And actually, you know what? We have to make sure that people don't fall into accepting the government line, which I think a lot of people aren't, because this government has lost a lot of its credibility for a whole variety of reasons. So I think, in many ways, even people who may not completely support our agenda are maybe potentially open to listen to us. I mean, ironically, I've been speaking at, yes, dare I say it, at corporate events during Black History Month, telling them about racism, structural racism, telling them about the work I've done around Windrush scandal, tell them about what they need to do. And it's interesting that corporates are, I'm not defending corporates, I'm trying to say that even they are open, they realize that they have to do something a bit different, basically. So I think one of the key things that we need to explore as campaigners and activists in this turbulent change in times is, how do we use our influence? How do we use structures to hold the narrative, and more importantly, to help
ask you to wrap up a bit. Sorry.
Sure, to further expose the government on a whole range of inequalities and structural racism in society. I mean, one of the reasons why Black History Month was established in the first place in 1926 in America, as it was called Negro History Week. Okay, I'll stop there then.
Thank you. Sorry. Sorry about that. Just trying to keep it into time, because we want to be able to hear from everyone, and everyone is excited to ask us some amazing questions to our speakers as well on where we go on. Hopefully you'll be able to develop on that, Patrick, later. Ron,
Okay.
It's important. It's completely, thank you for, yeah. So far, we have 1,600 people that have registered for this conference, and we're having more people registering. It is just to show that the fight for anti-racism and to fight for a better society for everyone, for equality and equity, is important to everyone out there. There are many of us, and there are many, there are of them. So yeah, like, it's amazing. It's very exciting. I'm gonna introduce our next speaker, Ashok Viswanathan, Operation Black Vote. Operation Black Vote exists to ensure we have greater racial justice and equality throughout the UK. Its areas of work includes voters registration, lobbying politicians, mentoring scheme, and political leadership program. Please do give a great welcome to Ashok.
Thank you, Myriam, and thank you for the invite and the opportunity to speak with you all today. It's great to be here, to network and to see old colleagues and meet new comrades. But frankly, I'd rather not be here. If you remember the speech that Greta Thunberg gave to the UN just 3 years ago, she said, "I shouldn't be here talking about climate change with you. You're the leaders. You should have eradicated and addressed this issue. Shame on you. And I think here we are in 2021 talking about racism in a society and a world where we should have eradicated it, and we should have had the committed leadership in the UK and abroad to address and eradicate it from our societies. And yet here we are. Here we are in a world where, with COVID having disproportionately impacted on Black communities, where Black people are 4 times more likely to die of COVID, where 6 of every 10 COVID care workers have been Black in terms of deaths, where more than 50% of bus drivers have died who are Black. 50% more have been Black. The first 20 doctors who died from COVID, 90% were Black. 3 racist murders at least have been committed by purposely infecting the virus to Black people. And COVID has just shone a spotlight, not just on its disproportionate impact on Black people, but the historical inequalities that have come out of it. Black African and Black Caribbean men are 3 times more likely to die of prostate cancer. Type 2 diabetes is 3.5 times more prevalent in South Asians. Infant mortality in England and Wales for children born to mothers from Pakistan is double the average. Young Asian women are twice more likely to commit suicide. Young Black men are 6 times more likely to be sectioned under the Mental Health Act. South Asian people are 50% more likely to die prematurely from coronary heart disease or suffer a stroke. The prevalence of stroke amongst African, Caribbean, and South Asian men is often 40 to 70% higher. Then you look at employment. Black people with identical qualifications and experience are twice as likely to be unemployed than their white counterparts. Black people are 48 times more likely to be on 0-hour contracts. Bangladeshi and Pakistani graduates are 12% less likely to be employed than their white counterparts. African Caribbean male graduates earn £7,000 less than their white counterparts. And of the 279 chief executives, only 7 are of Black heritage. Then you look at policing and criminal justice. African Caribbean men are twice as likely to die in police custody. Asian people are 4 times more likely to be stopped. African Caribbean men 10 times more, and in some areas 40 times more. Black offenders receiving immediate custodial sentences were found to be 1.5 times higher, and Black men are 3% of the population, yet make up 12% of the prison population. We need systematic change to fight racial discrimination alongside the Black Lives Matter movement. 4 times more people are not registered to vote in Black communities. Twice the number are likely not to vote on polling day. We need to campaign and reform within and without the political parties. It requires campaigns like this, but it also requires us playing a full and positive role in the democratic process, joining political parties and reforming them from within. The energy in our communities is high and the people are demanding equality and justice. Now we need to put together a detailed, achievable plan and deliver that to eradicate racism in all its forms in the UK and beyond. Thank you.
Thank you so much, Ashok. You have raised some really, really important point from how badly we are hit by society and by the justice system throughout the health system. I've had to encounter it as being a pregnant Black woman, so it's more than important now that we fight harder than we ever done, because things are just getting worse and worse. But as I said, there is more than us than them, and time for change is coming. I'm delighted to be introducing our next speaker. which is Sabby Dhalu, Stand Up to Racism, co-convener. Sabby is co-convener of Stand Up to Racism and has been and work alongside her in many campaigns. So warm welcome to Sabby.
Thank you very much, Myriam, and thank you everyone to all our previous speakers and everyone joining this session. I very much agree with Ashok's quote of Greta Thunberg that we shouldn't be here talking about racism because we should have leadership which is committed to eradicating racism. We need that at government level. But the reason why we are here is because instead of doing that, we've got a government that insists on denying institutional racism. So earlier this year, around 6 months ago, the government commissioned the Commission on Race and Ethnic Disparities. So the report examined employment, education, health, crime, and policing, and failed to conclude that institutional racism was a factor in race and ethnic disparities in these sectors. Now, any report that examines those sectors and doesn't conclude that institutional racism is a factor in that is denying the existence of institutional racism. And it flies in the face of every single report, commission, inquiry into the race and ethnic disparities and the impact that Black people and all BAME communities experience in these sectors. And obviously the most famous, I think, of all the inquiries previously was the landmark Stephen Lawrence inquiry, which was necessary due to the bungled police investigation of Stephen Lawrence's murder. And it coined the phrase institutional racism. And it was very transformative in race relations in Britain and a huge step forward. And Doreen Lawrence, Baroness Doreen Lawrence, Stephen Lawrence's mother, her response to the CRED report earlier this year was, "My son was murdered because of racism, and you cannot forget that. Once you start covering it up, it is giving the green light to racists." So, you know, that is a very serious condemnation of someone with direct experience of both institutional racism and having a son murdered in a racist attack. And the report was commissioned in the wake of the Black Lives Matter movement, which in itself emerged in the context of the outbreak of the COVID-19 global pandemic, which had a disproportionate impact, as many have said, on BAME communities. And there were numerous reports and studies at the time into this, and one of which was the independent SAGE report in July 2020, which found that Black people were 2.6 times as likely to be hospitalized, with Asians 1.4 times higher, and other ethnic groups 1.4 times higher. And the report said, "There is an urgent need for research to examine how structural racism plays out in the present pandemic and how policies developed to control the pandemic impact differently on BME communities. The very fact that we do not have such information is in itself an indication of the extent to which BME experiences and BME lives are undervalued in our society. Structural discrimination is of critical importance in determining the jobs that people get, the living conditions people experience, their access to different forms of public transport, and other factors that impact levels of exposure to infection. Moreover, racism renders people precarious, and those in precarious positions are less able to challenge conditions, particularly at work, which places them at risk. Structural racism is particularly likely to impact BME infections and mortality rates through systemic social and economic inequalities that drive health status. Racism also creates barriers to accessing healthcare." So very clear there about institutional racism, structural racism, systemic racism, and the impact on the health of Black communities. But instead of addressing the root cause of Black Lives Matter, i.e. Racism, the government have been covering up racism. So immediately in summer 2020, Public Health England did commission a review when it was clear that there was a disproportionate impact on BAME communities. The government tried to censor the Public Health England report, the section on racism. The government tried to censor it. After public pressure, the government were forced to back down, and that was published. And that report too concluded institutional racism was a factor. But instead, the government continued with their propaganda campaign, if you like, that denied institutional racism as a factor in the disproportionate impact of COVID. So later that year, exactly a year ago, Dr. Raghi Bali, commissioned by the government, said that institutional racism wasn't a factor. And then you had the CRED report earlier this year. So the correct response to Black Lives Matter and the disproportionate impact of COVID on BAME communities is, one, a public inquiry like the Stephen Lawrence inquiry into the disproportionate impact on BAME communities, because this has meant that tens of thousands of Black lives have been lost. We have to have a public inquiry. Secondly, we have to implement the recommendations of all previous reviews and inquiries. And finally, I very much agree with Lawrence Davies' proposal of transferring £3 billion to Black communities to address structural racism and inequalities. Thank you very much.
Thank you so much, Sabby, and thank you for being on time too. Thank you for that contribution. I think it's important that we hold the government that do not care about us accountable, but also pressure being put by all angles, from the street to the boardroom to the classroom, everywhere. And yeah, give money to our communities. That's the only way forward. Just a reminder that please, as I said earlier, for us to be able to make this happen, we need the money. So our amazing tech keep reminding for the donation and the link. So please feel free to give us as small as 50p will take, but if you have more, would be great too. I'm delighted to introduce our next speaker. Moyra Samuels, Grenfell campaigner and Home for All activist. Moyra is campaigning to expose the injustice that led to the atrocities of Grenfell. Please give a warm welcome to Moyra.
Thank you, everybody. I'm going to start by actually stealing a quote that's from Stormzy that he made at the Mercury Awards in 2018, where he said, "Theresa May, where's the money for Grenfell?" I'd like to say, Boris Johnson, where's the justice for Grenfell? Just forgot about Grenfell? You criminals? And you got the cheek to call us savages. You should do jail time. It's 52 months, a couple of days ago, where the bereaved, the survivors and the impacted community have had to reflect on our demands. Our demands straight after that fire, which were for truth, they were for change, and they were for justice. And we've heard months of truth from the public inquiry. I could spend hours discussing some of that, but I'm going to try and give a quick snapshot. We've heard that the local authority had no evacuation plans for people with disabilities. We heard that actually the smoke ventilation systems didn't work for 6 years. And the head of health and safety at RBKC, Janice Ray, when challenged by the fire brigade, said, "Let's just hope our luck holds and there is no fire." But we also heard subsequent to the fire that officers who were asked to come down to the area around Grenfell were heard to be said things like, referring to the community, that they have language problems, they have a lack of education and understanding of how anything works, with parts of the communities that are characterized as territorial and comparable to gangs. This is how our community has been depicted. But in terms of truth, we've also heard from the inquiry about the construction, the manufacturing industry that has been referred to as crooks, who then became killers, or crooks and killers, who had no regard actually for those living in the blocks that they actually were furnished with these dangerous material. And these in particular will span Oconic and Silotex, who we know in terms of truth actually, furnished high-rise buildings on the basis of high-rise cash. That's what they want to do, is make cash. And we've also heard that implicated essentially is the government with its poor regulation regime. But in the midst of all this, there is the Grenfell Tower community, a community that, as a consequence of this fire, has experienced trauma, grief, and loss. 85% of those people who died, those loved ones who died in the fire, were from a Black and minority ethnic community. And I think we really need to think of the specifics of that. I remember being reminded at the service at St. Paul's for those people who had died. As the bereaved left the service, it really hit me, because they were predominantly people from a Black and minority ethnic community. 32 of those people who died were from the Middle East or North Africa. 5 were from East Africa, 5 were from West Africa, 5 were from Bangladeshi heritage, 3 were Caribbean, and 1 from the Philippines, and 1 unknown. And 7 were white, British, Irish, or European. Leslie Thomas, a QC at the inquiry, says, Grenfell is inextricably linked with race. It's the elephant in the room, and this was, he spoke about it quite a bit recently, but this is what he said. If Grenfell Tower was neglected, not specifically because of the race of its tenants, but because they were poor, this is still capable of amounting to indirect racial discrimination, given that on average, Black and minority ethnic people in the UK are more likely to be poor than white people. We also know from copious housing surveys, Inside Housing now has a report called Racism in Housing, that actually 13% of mixed white and Black Caribbean people experience damp in housing, in comparison to 3% of white households, and 17% of Black and minority ethnic people experienced fuel poverty. So we're not going to get the change that we want. We're not going to, unless, the change that we want for everybody to live in safe and decent homes, unless we get prosecutions. The CPS has all the evidence it needs. The Metropolitan Police has all the evidence it needs. And so what we're asking for is actually, what are you waiting for? When are we going to see prosecutions? And that will mean that when we get prosecutions, we will get the change that we need so that everybody, all working class people, whether in private or social housing, are able to live in safe and decent homes. Thank you.
Thank you so much, Moyra, for doing this. Through my work, I am an organizer in housing, and I see this every day through our communities. For the past 2 weeks, illegal evictions, people living with more than damp that have got them having strokes. Some people have let them to death, actually, and this is like facts. And most of those people are from Black and brown communities and from working class communities. So it's extremely important that we focus as well around housing and the racism that are happening in housing from this big corporate like Clarion Housing, by councils, and so much more. So thank you so much we need to keep asking justice for Grenfell and for your amazing word. Just a reminder, we have our next speaker, last but not least. If you would like to make any contribution in the chat, please start raising your hand so we can start picking up hands. There is a little hand, raise your hand bottom at the bottom of the Zoom settings. So yeah. I will be introducing our last but not least speaker, Dr. Kambiz Boomla, GP, British Medical Association activist and senior lecturer at Queen Mary University. Dr. Boomla is a former GP, a lecturer at Queen Mary University who has been doing work to expose institutional racism as cause of disproportionate death and impact from COVID-19 on BAME communities. Please give a warm, warm, warm welcome to Dr. Kambiz.
Great, sorry, I was waiting to be unmuted, that's fine. Chair, thanks for asking me to speak today at this important conference. COVID's personal to all of us. We all know people who have died or have been badly infected. So I want to start by remembering some of my NHS and care worker colleagues in East London who have died. First off was Yusuf Ali, and he was a driver for Tower Hamlets Council taking children to special schools. And he died alone in his flat, as did Donald Swelter, a nurse who lived in Bow. And close to me was David Last, the caretaker handyman at my practice. He spent a week at home, sort of being brave before being admitted to hospital and dying. And then there was Dr. Yusuf Patel, a fellow GP, who became the 5th GP to die of COVID in Newham. And he died on Monday, the 20th of April in the first wave. He'd started his practice in 1989 and he built it up to 15,000 patients and trained many of the practice nurses that work in East London practices. At Homerton Hospital in Hackney, there was a particular doctor that I never knew who was called Dr. Abdul Mahbub Chowdhury. He was age 53 and he was a urologist, a waterworks doctor who died of COVID. 5 days before being admitted to hospital, he'd appealed for appropriate PPE, personal protective equipment and remedies to protect ourselves and our families. He wrote to Matt Hancock, Health Secretary, about that. His son said that he was so proud that his father had had the courage to point out that there was something wrong with what the government was doing. He wrote, "I'm glad it's getting the attention now that it needs to protect NHS workers on the front line, because it pains me to say that my father is not the first and unfortunately is not going to be the last NHS frontline worker to die." Now, we all know now that deaths amongst the deaths of NHS staff, 68% were from BAME backgrounds. Now, there are 1.2 million people working in the NHS and only 20% are from Black and ethnic minority backgrounds. But nonetheless, we were and are disproportionately dying. But this goes beyond just NHS staff. 35% of COVID patients in critical care were from BAME backgrounds when they represented only 13% of the population. In the first wave, you were 4 times more likely to die if you were Black and 3 times more likely if you were Asian. But this was not due to racial or genetic differences. It was due to increased exposure risk. And when, as people have said, the government's review of the ethnicity divide was published, which laid out some of the facts, it completely failed in fulfilling one of its main terms of reference, which was to make recommendations for action. Now, why was that? The answer in my mind is clear, because to have done so would have been to lay bare the structural racism within the NHS and within society at large that the government wasn't prepared to do. And I want to give you an idea of what that actually means, because you can talk about structural racism, but it isn't clear what it actually means. Now, when I was a young doctor, if you wanted to train as a nurse, and if you were Black, Filipino, Indian, or Pakistani or Irish, you got pushed into a 2-year state-enrolled nurse program that did not allow you to get promoted. So you stayed in the front line with high patient contact all your life. But if you were white British, you were more likely to get a state-registered nurse training that was 3 years and allowed promotion. And it was the same with doctors. The training opportunities went disproportionately to white British doctors. And that's mirrored in every job in the NHS. So it was no wonder that BAME workers got more exposure to the COVID virus and more deaths. especially when no effective PPE, personal protective equipment, was available. Now, sadly, COVID mirrors the structural inequalities in health that run through our society, where race and class determine who lives and who dies. Doreen Lawrence called for a race equality strategy to be implemented with ministerial accountability and targets. She called for ethnicity pay gaps to be mandatorily published amongst all big firms. And she called for an end of the hostile environment that affects our Windrush generation and many undocumented migrants. Now, will any of this happen? The government shows little sign of listening, understanding, or even wanting to understand. To give one example, the government's report said it was not ethnicity that caused the high death rates. It was simply because Black and Asian people are more obese and have more diabetes. But that ignores that it's the structural inequalities and structural racism in our society that makes Black and Asian people become more obese and have more diabetes. So what do we need? We need organizations like Stand Up to Racism and all the organizations and individuals that are taking part in this conference to say this out loud and to campaign for the sort of society where the color of your skin and what class you are makes no difference to whether you live or die. But to achieve this, I think we need to take up the struggle ourselves. It has to become an NHS trade union issue. So a victory in the NHS pay campaign would give many of us more confidence to fight on these issues of safety, discrimination, and structural racism. The election of Sharon Graham, who is speaking later on in this conference, will give us the confidence and help all of us in building that fight. But it's our action on the ground that's crucial. Thank you for listening.
Thank you so much, Kambiz. Yeah, we can go back to Lawrence for 2 minutes.
Hi. Yeah, I suppose I'd like to just begin where I ended, which is that in terms of race discrimination at work, the first thing we need to do is just transfer the 300 billion into the Black communities and invest, and then take that as a first step forward. And anything else really less than that is going to be largely cosmetic. In terms of health inequalities, which Elsie mentioned, I completely agree with that. Situation's a national scandal. COVID's just the tip of the iceberg on that. Health inequalities, as the Marmot report reported in 2010, are pretty horrific and are not being addressed and need to be. In terms of institutional racism, I have a problem with that in the sense that it was a good term. But remember, institutional racism is not unlawful. So even though the Stephen Lawrence report coined the term and it's of useful to understand a problem within an organization, is not unlawful. So whether my organization is institutionally racist or not makes no difference at all in law. You can't sue for that. And that was a great omission from the Race Relations Amendment Act of 1981. And the fact that no one really spotted that was quite appalling. I mean, the Race Relations Amendment Act 1981, of course, no one uses it because it's a completely useless piece of legislation. And that's why when I worked with Doreen Lawrence in 2003, when I was head of employment at Imran Khan and Partners, Doreen said to me the position in 2003 was actually worse than it was on the ground in 1993 when her son was brutally murdered by racists. So watch out for institutional racism, because unless you make it unlawful, it's just a term for sociologists to ban around. It doesn't really help us move forward.
Thank you so much, Lauren. Patrick, do you want to come back?
I think Patrick is no longer in the Zoom.
Okay. Ashok?
Sure. Thank you, Myriam, and thank you to all the speakers. It was really great to hear such a variety of insights and to hear what everyone else is doing in the fight and struggle against racism. I'll just pick up on something that Samuel said in the chat and also in his contribution, which is, can we use this ghastly 2 years that we've lived under with COVID and the inadequate response of government to tackle COVID and the inequalities and also the historical inequalities. It's a real wasted opportunity, but I suppose in every crisis, there are opportunities for everybody. And so this is an opportunity, I think, for us to redouble our efforts. I think you know, it's farcical that the acronym for the race disparity report is CRED, because I think right from day one, even when they were trailing the report, it was shot down, and it's seen for what it is, which is a sham, a total disregard to the present and ongoing inequalities that our communities face, and you know, it's dead in the water. So we need to really redouble our efforts to organize and mobilize and get the data out there and push political parties and media and community groups to really redouble their efforts around this. And that means doing things from without, community activism, civil society, but also playing a full and positive role in the democratic and decision-making process. Remember, power is never given. Power concedes nothing without demands, organization, mobilization, and activism. Thank you.
Thank you, Ashok. Thank you so much. Sabby?
Thank you so much. Yeah, thank you everyone for your really interesting contribution. So I will try and address as many of them as I can. So firstly, on the point about class and racism, so I very much agree that the Sewell report tried to pit communities against one another, and it sort of cynically tried to present itself as somehow sympathetic to the working class, and how, you know, that was more of a factor to explain race and ethnic disparities than racism. And, you know, firstly, that's nonsense, and secondly, it didn't address the fact that actually Black communities and all, you know, all BAME communities, Asian and minority ethnic communities, are, for a greater proportion of those communities, are working class than their white counterparts. So actually attacks on the working class are exacerbated by racism, as we saw, as we've seen and continuing to see since 2010, and the various conservative governments have implemented austerity, and that had a disproportionate impact on Black and all BAME communities. So which wasn't at all addressed in the report. So I think, you know, it's very cynical to sort of try and present itself as somehow sympathetic to the working class, as though it's separate to the experience of racism that Black communities face, because obviously it's a double whammy for the Black and all BAME communities. Secondly, on the point on Black and Black crime, I mean, I agree, we shouldn't be using terminologies like Black on Black crime. You know, that is racist, because it implies that Black people are more likely to commit crime, and that they're more likely to commit it on, you know, their own Black communities, which is nonsense. There's no evidence that suggests that there is greater crime amongst the Black community. Actually, you know, no one calls, when white people commit crime, the majority of crime in this country is committed by white people on white people. No one calls it white on white crime, so we shouldn't call it Black on Black crime, you know. So I completely agree with that point. And then on the very good point about Black women's health, I very much agree with that contribution. I had a difficult birth myself when I gave birth to my daughter, which was a very long time ago now. But the statistics are shocking. And I very much agree that, you know, in future that we need to have a speaker from campaigns that specialise in Black women's health and addressing those issues. So I definitely agree with that. And then I think on the really interesting contribution by the student who's been here for a year from Africa. Yeah, I mean, I think the experience of BAME is essentially the experience of racism. So I think that's what all African, Asian, Caribbean, Middle Eastern, well, you know, all BAME communities experience is racism. So the experience might be slightly different and varied. Obviously, religion, culture, and so on, traditions might be different, but the experience of racism is the same. And so I think it underlines why we have to unite against racism. Thank you.
Thank you, Sabby. Moyra?
Yes, thank you everyone for really interesting discussion. In terms of housing, I wanted to say before I talked about housing was to actually just comment on what Elsie said about health. We do know the stats, as Sabby said, about pregnancy and Black women, 4 times more likely to die. But the other issue that impacts very real on the Grenfell impacted community, both the bereaved survivors and the community, is the question of mental health. And, it would be good at future conferences if we could have under the health banner something that looked at mental health. We know actually how overrepresented Black men are within the mental health service. And the experience that they have. So many deaths in custody have come from, as a result of Black men who've been having mental health episodes. What we experience in the community here at the moment is the impact of that fire on people's mental health. Add to that the experience of COVID and the isolation. And we do have what some call a mental health tsunami to some extent. So I think that actually, this is something we need to fight, especially because we also know that refugees and asylum seekers are also more likely to experience mental health difficulties. And, many of the people in the tower actually were themselves, as I said, from the data of who died, the stats who died, people who died, came from refugee communities. So they'd already had the experience of war and displacement. So, it's really important. But again, coming back to the point that Charlie made, this is Grenfell for all of us was an intersection between race and class, because we'd seen actually what had happened, the worst fire since the Second World War, the deaths in the fire, in one of the richest boroughs. And this is as a consequences that we'd seen that been happening all over the country of gentrification. So this is a question that is impacting on working class communities right across London, and that unless, it seems so obvious to say that actually we all need somewhere safe and decent to live, because the ramifications are so huge in terms of health and education, everything. So unless we actually get together, I think, communities, whether you're in private, whether you're in social housing, whether you're a leaseholder that's fighting to get rid of cladding, on your building, let's all get together and let's actually, get our knees on this government to actually change their attitudes and to ensure that everybody has somewhere safe and decent to live. Thank you.
Thank you so much, Moyra. Thank you. Kambiz?
Yes, thank you. The contributions were great, and all the other speakers as well. But I want to concentrate really on how we get from here to there, because we've spent a time discussing the fact that the inequalities exist, that the government doesn't want to do much about it. But we also need to discuss how we're going to shift that. And I want to give one example. That the hospital that's closest to where I live is the Royal London in Whitechapel, and there's a group of cooks and cleaners there who are outsourced to a privatized company called Serco, and they get paid awful wages. Their shifts get changed from one day to the other. So people with children, and they're mainly Black and ethnic minority. Women that work as cleaners and domestics and ward clerks and so on in the hospital, and they get their rotas messed around with, so they can't pick up their kids and so on. And they decided that they would go on strike about this, and there was a small little strike, and it didn't last very long, but they won. And out of that has come a confidence that people are prepared to take on other issues. So that's why I come back to the fact that if we're going to build around health a fight that will tackle the institutional and structural racism within the NHS at a moment when health workers are demoralized and worn out by the whole COVID experience, and as a GP, I can say, At the moment, we're getting hit by Daily Mail propaganda that it's all our fault that COVID's happened and so on. That has to come from building on victories. And so I think that if we were to get a big victory on pay, that would give us all the confidence to fight on structural racism. And when I was a medical student, there were victories on pay, and it motivated hospital workers to kick out pay beds from the NHS in the time of Barbara Castle. We did it then. I think we could do it now. Thank you.
Thank you so much, Dr. Kambiz. I would like just to add on that, I think it's very important that we talk about what we do next from here and through my line of work. And I think community organizing and mobilizing is one of the key issues. And when I say that, to follow from Dr. Kambiz, is like organizing within housing, organizing within our own structures, whether you're a cleaner, whether you're a teacher, how we need to organize, because the system from we can see inequality, racism, and how the working class people have bitten is from the day they go to kindergarten all the way to university and now in their job spaces. So organizing and mobilizing is one of the key things to do, but also how we build a sense of community. Because why me living in London and coming from someone that live in Senegal and Paris, there is no sense of community here in London. How do we build a sense of community? How we make sure that people that aren't political, people like my mom or my aunties, can be in these spaces? We need to make sure next time there is events like this, we mobilize in our community and make sure people are brought along in these spaces and they can contribute through their experiences. Because people may not be having a PhD or going to university, but our lived experiences can speak volume on how we deal with institution and how we organize against it. The fight won't go. We can't fight alone without having a mass movement where everyone can see themselves within it. Thank you so much to our speakers and for sticking around, and thank you to the tech team as well for making this happen. Thank you for Stand Up to Racism for making this happen as well, and thank you for everyone for turning up. The next plenary will be at 5 p.m. and will be international. You'll hear from a lot of international people, because this fight of racism without internationalism would be void. So please go to that event, stick around and go at 5 p.m. Thank you so much. And now this session is closed.